Hi, this is Diane Rose Solomon with What's Plant-Based Cooking Good Looking? And I want to tell you a story about a plant-based cardiac surgeon. And it's based upon a Substack article that I wrote called A Plant-Based Cardiac Surgeon's Dilemma. Here's the story. My brother Michael is a surgeon, and he doesn't usually introduce me to his colleagues. But Dr. Harold Fernandez posted a Facebook post maybe a year or so ago of him about the benefits of plant-based eating. He and his wife were cooking in the kitchen, and my brother knew I'd be interested. And the way they know each other is that they were surgical residents together at NYU many, many years ago. So Dr. Fernandez is a Princeton undergrad, Harvard Medical School graduate, and he was born in Medellin, Colombia. And at the age 13, he and his brother fled the country due to drug violence. His parents came to the States first. It's really quite a remarkable story. They came by boat. In fact, it is so remarkable that it was featured in the New York Times in 2009. You're welcome to look it up. Modern medicine is lucky to have this man. Now he's a cardiothoracic surgeon in New York, and he saves lives daily with stents and open heart surgery and medication, things that are typical of cardiac surgeons. But in 2017, his perspective shifted when he researched the healthiest diet and lifestyle that one could have, and he discovered plant-based nutrition. And he learned that a plant-based lifestyle can prevent and reverse heart disease. Unfortunately, none of this information is taught in medical school. In fact, the majority of our Western medical system is designed to treat disease, not prevent it, because there's more profit in sickness than in health. And with powerful industries like the meat and dairy influencing dietary norms, the status quo remains, even at the expense of public health. Since 2017, Dr. Fernandez has followed a plant-based lifestyle, and alongside his wife, they've gone fully vegan, including the ethical reasons. He encourages his patients to adopt plant-based eating, but only a few take his advice seriously. Ironically, many cardiologists succumb to heart disease themselves, largely because they too don't understand how to eat for heart health. Well, this Facebook post that he had featured them cooking together, and it generated a lot of responses in both English and Spanish. And the comments revealed a common theme. People are curious, but they're overwhelmed by the idea of change. Our culture conditions us to view meat, dairy, and eggs as the staples, and making dietary shifts seems daunting, and I totally understand this. So here's Dr. Fernandez's dilemma. Day after day, he operates on patients who likely would never have needed surgery or medication if they had always followed a plant-based lifestyle. Many of them will never heed his advice to eat plant-based and will find themselves back on his operating table, or worse. Okay, maybe dilemma isn't the right word to use. Dr. Fernandez does not have a dilemma. His commitment is to save lives. I think frustration is a better word. I can't imagine his frustration knowing what he knows about health and potential life-saving benefits of a plant-based lifestyle. And until plant-based eating becomes mainstream, and while there's a need, Dr. Fernandez will keep performing surgeries. But he's also working on initiatives to spread awareness and make plant-based living more accessible. Dr. Kim Williams, who is the former president of the American College of Cardiology, said, "There are two kinds of cardiologists, vegans and those who haven't read the data." Dr. Fernandez has read the data. I have tremendous respect for him, his accomplishments, and his desire to help people. And his work, dedication, and advocacy are inspiring. And if you'd like to learn more, check out his book. It's called Undocumented: My Journey to Princeton and Harvard and My Life as a Heart Surgeon.